it's Chris with Rowe Dental Laboratory, and today I want to highlight this little book we've been working on for a while to make your lives way easier when it comes to full arch restorations and how to get them done. This is the Ultimate Restorative Protocol Guide. Now, in this guide, it has all the different workflows, analog and digital, as to how to get to your prototype or your printed try-in and then your final fixed prosthesis. And then it has the different scenarios. So as the patient, how do they present when they come into your office? Now, we've put together, there are 4 patient scenarios in the full arch world as to how they can walk through your doors. And just in the first page here, we have, first couple pages, we have them listed here. It's the patient walks in with just implants placed, and there's healing caps on the implants. They could come in with implants and multi-unit abutments seated already with healing caps, or they could walk through your doors with implants and the fixed prosthesis is their temporary, and you have to get them into their prototype and then final. And then the last scenario is an overdenture that you want to convert to a fixed. Now, there's challenges with all these, and we're going to kind of go through some of those challenges. All right, in this scenario, the patient is walking into your office, and they have a loaded prosthesis fixed on multi-unit abutments. Now, there are a few different great ways to get this done in the digital world, or you can do it in the analog world. The issue with this is how to get those records to the lab, because we need to establish the correct vertical for the next prosthesis and passivity. So again, there's a digital workflow you can do with the patented iJig. Again, listed in this book. There's an analog workflow where you can flask the existing prosthesis, put some analogs in stone. It requires some lab work, but then again, that gets you to a printed try-in and then ultimately a final. So the fixed prosthesis on multi-unit abutments, you're in pretty good shape here. Not much to worry about, but there's still a little bit of work you got to do. 2 to 3 appointments, typically, maybe a fourth in there to get to your final, but you're a lot closer in this particular scenario. And again, we have all the different digital and analog workflows all listed out for you in this book. So there's a ton of great workflows in this. Again, digital and analog, we got you covered no matter what the patient scenario is. You can download this from our website in an ebook version, or we can send you a physical version as well. Please give us a call with any questions here at the lab. Follow us on our socials. We have some great information on there on not just full arch, but everything in the lab world. And we look forward to working with you on your next full arch case. Thank you.